We're at the IAS meeting in Amsterdam. We're here with George Ayala, who's Executive Director of MPact Global Organization, and I'm going to let you take it from there and give us more of a background on the organization.
Sure. Our organization was founded in 2006 at an international AIDS conference in Toronto by a group of gay and bisexual men who were really quite worried about the relative silence at the time about how HIV was disproportionately impacting gay and bisexual men. It was simply not fashionable to talk openly about these issues. And since then, we've organized ourselves. We have programs operating and funded partnerships with organizations across 62 countries.
Mm-hmm. And what are some of the primary objectives that you are doing?
Our number one objective is to ensure equitable access to HIV-related services while promoting the sexual health and rights of gay men.
And how do you do that with, what are the media that you use to communicate with most of the folks in all these organizations?
Sure. We mainly do it through relationships that we establish with activists and advocates, with service providers who are doing the work at country level. We try to facilitate a meaningful exchange of information between advocates, so that advocates who are doing work in sub-Saharan Africa, for example, are aware of what's going on in Latin America, the Caribbean, and
so there's models that they can look at and say, gee, that might work for us.
That's right. And peer exchange is really kind of the principal way we encourage capacity strengthening.
Mm-hmm. Do you have webinars or online for your organizations?
We do. We have a rather strong online presence. A lot of our work gets done that way, webinars, teleconferences, but we also have a very strong social media presence. People follow us on our Facebook page and Twitter feeds, and it's a principal way for people to communicate with one another, especially in places in the world where it's not safe.
Mm-hmm. So places that are anti-even gay, and countries which are criminalizing. You can still communicate with the folks there and try to figure out how to maybe walk softly, in other cases a little bit more aggressively.
That's right.
Whatever you have to do to make it work.
Yeah, more than 70 countries still criminalize same-sex sexual behavior. That makes it obviously really quite difficult for gay men to find the services that they need, to get basic things like HIV testing or even condoms. And so even despite the kind of punitive criminal and policy environments in which we have to do this work, men find creative ways to find each other. Sometimes that means finding each other online. And there are some really beautiful programs happening under those conditions. Those programs end up being safe havens. Sometimes government officials find those places and they shut them down. But advocates always find a way to stay resilient. And it's a huge challenge, I think.
Mm-hmm. So with it looks like we're always looking for role models. And I don't know if we can inspire role models who are like in sports and so forth, who could come forward and be more out there about helping to normalize these issues and decriminalize and be a voice against this sort of thing. I certainly know that Elton John, but of course he's in the music industry, which is kind of in that ilk. But a lot of people are out there in the all kinds of sports that could be very useful if they were gotten to and were able to understand the significance of how decriminalization would improve the prospect of ending this disease.
Yeah, we need our role models and who can kind of give voice, especially where it's difficult for people from the community to kind of voice these issues. And we have to depend on allies to educate their peers, and we do quite a bit of educating of healthcare providers, for example, and people in health ministries who have been taking strong leadership positions. And then educating media is another way, getting to journalists who are friendly to our issues, and as a way to raise public awareness about how discrimination and stigma and criminalization and violence really undermine our ability to do good HIV work.
So what is do you have any future plans that we should know about?
Sure. We're organizing quite intensely in partnership with young gay men. More than half of our international steering committee is now comprised of young men under the age of 30. They're bringing new ideas to us. We issued a global challenge a little earlier this year, where we asked for youth-led, gay-led, innovative solutions to sexual health and rights of gay men. We got nearly 40 submissions. They came in the form of short videos. And then we brought 12 finalists here to Amsterdam, and we organized a full day around those 12 solutions. And we think that bottom-up solutions are really quite key in getting out in front of the HIV epidemic. Top-down solutions don't work because there's no ownership from the community. So we're really trying to encourage that. We're also trying to encourage sensitization programs of healthcare providers, so that we're eliminating barriers to basic health services for gay men. We're creating pockets or islands of safety and havens for gay men to congregate, to meet each other, to share support and to exchange information.
Great. It's great work, George. I appreciate it. And
Thank you.
I wish you luck.
Thank you for the opportunity.
You need it with the work ahead.
Thank you very much. I appreciate that.